would you recommend to our clinicians if they did have a patient who was harassing them?
Yeah, look, I think it's really, really important to take action. Quite often doctors let these things slide, and the patient leaves and they don't worry about it till next time. So we're certainly all for being proactive about dealing with patients who are harassing or threatening patients. And look, basically, as a private doctor in Australia, you don't have to see any patient unless it's a life-threatening emergency. It's a bit trickier in the public hospitals, but I think we all need to get behind doctors who, for instance, are being harassed or feeling threatened, and help our colleagues. We all know the terrible stories of people being physically attacked in hospitals and the zero tolerance, but it really doesn't seem to transfer through to those people who are a little bit less likely to be physically violent, but still make doctors feel uncomfortable. And as you said earlier, that means they can't perform their tasks and work because they're distracted by feelings of fear. So look, I had a doctor call me who basically said, look, every time I see my outpatients list and I see this little girl's name on it, I just feel all these physical fear emotions, because her father is so difficult to deal with. Every time I see this little girl, I'm going to have all sorts of problems, phone calls and abuse from the dad. And he said, but I'm fairly specialised in this area, and this girl would be really difficult to disengage. And I said, well, look, you obviously can't have you feeling like that. You must do something about it, and you maybe must stop seeing her, even if that's unfortunate for her and her other family members. I said, well, what you could do is you could actually tell him how you're feeling. Make a contract, which, as you're probably aware, people can do. So you contract with the patient that they will behave in a certain way, or you will be unable to see them. And he actually phoned me back a couple of weeks later. This was a while ago, so I haven't heard from him to see how it's continued. But he said, look, that was amazing. I actually did say to this dad, look, I'm going to have to stop seeing your family if you're not a little bit more cooperative and pleasant. And it was working. So sometimes telling the patient, obviously with the right backup, and contracting with the patient to behave. Look, we all know that there are patients that's just not going to work for. They don't have enough insight. So I think, look, the other thing is to be really open about the fact with your colleagues that you're feeling threatened, and don't feel at all ashamed, because obviously it's really, really important. Chances are the other colleagues will have felt the same way. Sometimes it's better for the patient for the care to be transferred or seen by someone else. That happens all the time. Look, again, as we were talking about documenting it, document what the patient has said and exactly who was there, so that if there's any repercussions, they can have all the right witnesses, etc. So, look, I think the other thing is if you're feeling that threatened, I quite often tell people to call the police. And that often surprises clinicians, because I think we're kind of a can-do, fix-it type of people, and so sometimes we think we can control things even better than the police. And so a standard line that I use is the police are the experts in violence, we aren't, and you want an expert for the job. So I think we need to have a lower threshold for calling the police, calling security, if we're in these situations to get help.